Okay, so let's dive into something that can turn any pet owner's world upside down faster than, well, a squirrel in a dog park. Bloody diarrhea in dogs.
Oh, yeah.
Specifically, we're going to unpack the mystery behind those alarming streaks of red and a condition now known as Acute Hemorrhagic Diarrhea Syndrome, or AHDS.
That's right.
You might still hear people, maybe online or older sources, call it HGE, Hemorrhagic Gastroenteritis.
Absolutely. And
Oh,
seeing blood in your dog's poop is, it's one of those things that sends you straight into panic mode. And rightly so.
totally.
Our aim with this deep dive is really to shed some light on what could be happening, especially when HDS is a possibility, and, well, give you the information you need without all this super scary medical jargon if we can.
Exactly. Whether you're a pet parent currently, maybe playing detective with your dog's recent bathroom habits, or, a bright-eyed veterinary student trying to piece together the puzzle of canine ailments, we hope this helps. We've looked through quite a bit of information articles from Veterinary Partner, the ever-reliable MSD Veterinary Manual, even a textbook chapter on diarrhea, plus insights from BSAVA, PDSA, Medivet, and Vets Now.
Quite the reading list.
Yeah, so we've done the reading, so you don't have to.
Wow.
Unless you really want to, of course. No judgment.
Right. Our mission today is pretty clear, though. To get a solid understanding of what can cause bloody diarrhea in our furry friends, with a sharp focus on AHDS. We talk about how vets diagnose it, what the treatment involves, spoiler alert, often a lot of fluids, and why getting help quickly is just absolutely crucial.
And we'll try to keep it engaging, easy to follow, maybe even, crack a few tasteful jokes.
And try.
Because sometimes a little humor helps when dealing with a situation that's really not funny at all.
Definitely.
So, let's get right to it. You spot blood in your dog's stool. It can be alarming, to say the least. Now, bloody diarrhea, particularly that bright red kind we often see with AHDS, that's called Hematochezia.
Fancy word.
Fancy word, yeah. You can impress your friends. It's a sign that something's amiss in their digestive tract. But it's important to remember, the blood can actually come from different places along that whole system, right?
Precisely. If the blood comes from higher up, like the stomach or the upper small intestine, it often gets digested on the way through.
Okay.
So you end up with that dark, Tarry stool known as Melena. Some people say it looks like old coffee grounds.
Right, I've heard that.
Bright red blood, hematochezia, usually means the bleeding is happening lower down large intestine or rectum. And since AHDS primarily hits the intestines, we're often seeing that unmistakable bright red color.
Okay.
And it's that sudden, just out-of-nowhere appearance of this bloody diarrhea that can really make us suspect something like AHDS.
Okay, so that paints a vivid, if slightly unpleasant picture. Now, let's zoom in on AHDS itself, this acute hemorrhagic diarrhea syndrome. As we mentioned, it used to be HGE. Why the name change? And what exactly makes AHDS different from just, well, a regular bad case of the runs with some blood?
Yeah, the shift to calling it AHDS is more recent, and it's really about being more accurate. Hemorrhagic gastroenteritis literally means inflammation of the stomach and intestines with bleeding.
Okay.
But what we typically see in this specific syndrome isn't characterized by significant inflammation in the stomach itself. AHDS is a very particular syndrome in dogs, almost like a specific flavor of intestinal upset that involves a lot of blood.
So it's more focused on the intestines.
Exactly. That more general bleeding and inflammation, that can be caused by a whole host of other serious things. Parvovirus, pancreatitis, IBD, foreign bodies.
Right, the list goes on.
It does. So AHDS is its own distinct and often rather dramatic entity.
Got it. So AHDS is like the diva of bloody diarrhea, sudden, dramatic, specific quirks. What are those telltale signs that might make a vet or a very worried owner think, uh-oh, this could be AHDS?
There are several key red flags, pun intended, I guess. First is that it comes on incredibly suddenly, like a dog that seemed perfectly fine hours before suddenly develops this profuse, bloody, watery diarrhea.
Yeah.
And this diarrhea is often described in, well, pretty graphic terms. People say it looks like raspberry jam or sometimes even just straight up liquid blood.
Yikes. Raspberry jam. Okay.
Another very common sign in about 80% of cases is vomiting. And what's interesting is that the vomiting often starts before the really dramatic bloody diarrhea, maybe by about 10 hours or so.
Oh, interesting. So vomiting first, then the diarrhea.
Often, yeah. And sometimes the vomit itself might even have blood in it. It's like their body is staging a two-part drama. Starts with nausea, then moves to the main bloody event.
Wow. Okay, that sounds like a rapid and really alarming escalation. What other clues should we be looking out for?
Significant dehydration is another big one. And often the level of dehydration seems way worse than you'd expect just from the amount of diarrhea you're actually seeing.
Why is that?
It happens because the lining of their intestines becomes extra permeable, sort of leaky. It means fluids are just leaking out of the body much faster than they should be into the gut.
Okay, that makes sense.
And if this dehydration isn't tackled quickly with fluids, it can lead to a rapid spiral down into shock and, in the really sad cases, even death.
It's scary.
It is. But here's the somewhat reassuring part. With prompt and appropriate veterinary care, the vast majority of dogs with AHDS actually bounce back remarkably quickly.
Okay, that's good to know. But that rapid progression to shock definitely raises the stakes. Are certain types of dogs more likely to get this AHDS drama?
It does seem that way. Smaller breeds seem more prone, particularly young ones like miniature Poodles, miniature Schnauzers, Yorkshire Terriers. They appear to be more susceptible.
Little guys.
Yeah, like they have a bit of a predisposition. However, it's really important to stress that any dog, any size, any breed can be affected.
Good point.
Interestingly, things like stress and hyperactivity have also been mentioned as potential, maybe predisposing factors. Perhaps all that nervous energy can upset their gut balance.
Possible.
One bit of good news, though, is that AHDS isn't considered contagious, so you don't typically have to worry about it spreading to your other pets.
That's a relief for multi-pet households.
Definitely. The typical age we see it is around 5 years old, and the average size is maybe around 25 pounds. But again, those are just general trends, not hard rules.
Okay, so we have the sudden, very bloody, watery mess, often with vomiting starting first. Seems to like smaller, maybe more high-strung dogs. But what's the villain here? What actually causes AHDS?
The million-dollar question. And the truth is, the exact cause of AHDS is still a bit of a medical whodunit. Researchers are actively trying to figure it out for sure.
Still some mystery, then.
Still some mystery. However, the leading suspect right now is an infection with a specific type of bacteria called Clostridium perfringens type A.
Clostridium. Okay, I've heard of that causing tummy upset.
Yes. But what makes this particular strain interesting is that it produces two specific toxins, Net E and Net F. Charming names, I know.
Net E and Net F. Sounds like a bad sci-fi movie.
They're different from the more common Clostridial enterotoxin that usually just causes, regular diarrhea. These guys are different.
So these specific toxins, Net E and Net F, the troublemakers, how do they cause so much bloody havoc?
Exactly. These Net E and Net F toxins can actually cause ulceration and damage to the delicate lining of the intestine. Think of it like them creating tiny little wounds inside the gut wall.
Ouch!
This damage leads to bleeding into the intestines, obviously, but it also increases the permeability of that lining, makes it leakier.
Back to the leakiness and dehydration.
Precisely. That increased permeability means fluids, proteins, even red blood cells can leak out of the bloodstream and into the gut. That causes the severe dehydration and also contributes to that high concentration of red blood cells we often see in blood tests.
Okay. Is there a test for these specific toxins or bacteria?
There is, actually. A PCR test can detect the presence of these Clostridium perfringens type A bacteria and the genes that produce those specific Net E and F toxins.
So that can help confirm suspicions.
It can add evidence, yes, but it's not the whole story.
Right. Are there any other potential accomplices, other contributing factors the sources mention?
Yes. While Clostridium perfringens type A, with its toxins, is the main focus, the sources also mention a few other possibilities that might sort of play a role or tip the scales towards developing AHDS.
Like what?
Things like dietary indiscretion. When your dog eats something they absolutely shouldn't have, like the entire contents of the bin.
Been there.
We've all been there. Also, immune-mediated issues, maybe exposure to certain toxins, inflammation of the pancreas, pancreatitis, and those stress, anxiety, and hyperactivity factors we mentioned earlier.
Yeah.
One source even suggests that eating raw meat and poultry could be a factor, although, honestly, more research is needed to really connect all those dots firmly.
So it sounds like it might be a combination of things in some cases.
It could be. It's like a complex puzzle, and we might still be missing a few pieces to see the full picture.
Okay, so it's still a bit fuzzy on the exact cause, but that Clostridium theory seems pretty strong. Now, if a dog comes into the clinic with these really dramatic, bloody symptoms, how does a vet actually figure out if it's AHDS and not one of those other nasty conditions that can look similar? Because you mentioned quite a list.
That's a really crucial question, and you're right, the list is long. There's no single definitive AHDS test that gives a simple yes or no answer.
No magic bullet.
No magic bullet, unfortunately.
Yeah.
Diagnosing AHDS is much more a process of elimination. We have to carefully rule out all those other potential causes of bloody diarrhea first.
Why is that so critical?
Because, as we touched on, things like parvovirus, which is highly contagious and often fatal in puppies, or Addison's disease, intestinal parasites, even ingesting rat poison, pancreatitis, foreign objects stuck in the gut, blood clotting problems, severe ulcers, cancer, or even a tear in the gut, they can all present with very similar alarming signs.
Wow, okay, so you have to be sure.
You absolutely have to be thorough to make sure you're not missing something else that needs a completely different treatment plan.
Right. So it's like a medical detective game. What kind of clues, tests, exams will a vet be looking for?
Exactly. It starts, as always, with getting a really detailed history from the owner. When did the symptoms start? What's their vaccination history? Any chance they ate something weird? Then a thorough physical examination is essential.
Of course.
But one of the key diagnostic tools that really helps us lean towards AHDS is a simple blood test called the packed cell volume, or PCV. You might also hear it called hematocrit.
PCV.
This test, which we can often run right there in the clinic pretty quickly with just a tiny blood sample, tells us the percentage of red blood cells in the total volume of blood.
Okay, PCV, red blood cell percentage. How does that specifically point towards AHDS?
Well, in a normal, healthy, hydrated dog, the PCV is usually somewhere between, say, 37% and 55%. And when a dog gets severely dehydrated, like we see in AHDS,
The fluid part of the blood goes down.
exactly, the liquid plasma portion decreases. So the red blood cells become much more concentrated relative to the total volume. That percentage, the PCV, goes up.
Ah, like juice pulp concentrating when water evaporates.
That's a great analogy. So in dogs with AHDS, because they're losing so much fluid into their leaky intestines, we often see a significantly elevated PCV. A typical reading might be 57% or even higher, sometimes well over 60%.
60%, that's high.
It is, and this high PCV, due to fluid loss, is what we call hemoconcentration. It's a major indicator of severe dehydration.
That makes perfect sense. So a surprisingly high red blood cell count in a very sick dog with bloody diarrhea points strongly to AHDS because of that massive fluid loss. Anything else in the blood work?
Yes. Another interesting and often quite helpful finding in AHDS is that the level of total protein in the blood is often normal, or sometimes even lower than normal.
Wait, why lower if they're losing fluid? Wouldn't protein concentrate too?
You'd think so, but remember that leaky gut. Along with the fluid, protein is also leaking out of the bloodstream into the damaged intestines.
Ah, right. So fluid loss raises PCV, but protein loss counteracts the concentration effect, or even lowers it.
Exactly. So finding that combination, a high PCV with relatively normal or low total protein, is another strong piece of evidence pointing specifically towards AHDS, rather than just simple dehydration from another cause.
Okay, that's a key distinction.
We'll also likely run a full blood count to check their white blood cells, look for signs of infection or inflammation, and check their electrolytes, sodium, potassium, chloride, because those can get really out of whack with all the fluid loss and diarrhea.
Right. So putting it all together, high PCV, normal to low protein, that sudden onset of really watery, bloody diarrhea, often with vomiting first, maybe in a younger, smaller dog. Sounds like vets are building a case based on these specific clues.
Exactly. One of our sources, Veterinary Partner, actually has a nice summary of the key features vets look for, and it lines up perfectly. PCV, 57% or higher, relatively low total protein, at least one vomit about 10 hours before the diarrhea, that really watery, intensely bloody diarrhea, relatively young dog, around 5, relatively small dog, around 25 pounds, and importantly, a rapid positive response once we start aggressive 5-V fluid therapy.
Ah, the response to treatment is also a clue.
A big one. And because ruling out those other serious conditions is so critical, we might also recommend imaging, like x-rays or maybe an ultrasound, to look for blockages, foreign objects, signs of pancreatitis or other abdominal issues. And we'll definitely want to analyze a fecal sample check for parasites, maybe specific bacteria like Salmonella, or run that PCR for Clostridium perfringens toxins.
Okay, so diagnosis is a careful process, looking at the whole picture, ruling things out. Now let's talk treatment. Once a vet suspects or confirms AHDS, what's the game plan? What do they do?
The absolute cornerstone, the number one most critical thing, is aggressive intravenous fluid therapy, 4-V fluids.
Right into the vein.
Directly into the vein. As we've hammered home, these dogs are often severely dehydrated, potentially heading towards shock. Getting fluids directly into their bloodstream is vital to rehydrate them, bring that dangerously high PCV back down towards normal, support their circulation, and prevent them from going into life-threatening hypovolemic shock.
So it's literally life-saving.
Absolutely life-saving. Without those fluids, their red blood cell count just keeps climbing as they get more dehydrated. It's like trying to run an engine on sludge instead of oil. The fluids dilute the blood back to normal and restore volume.
So the IV drip is the superhero here. What other support do these poor pups typically need while they're getting fluids?
Good question. Along with the fluids, we'll typically give medications to control the nausea and vomiting antiemetics. Common ones are meropitant, maybe metoclopramide.
To stop them feeling so sick.
Exactly. And pain management is also really important. Their guts are incredibly inflamed and painful. So we might use pain relievers, often opioids like methadone, buprenorphine, butorphanol, or sometimes tramadol, depending on the severity.
We seem more comfortable.
Yes. And sometimes vets will use gastrointestinal protectants like succulfate. It's a medication that can kind of coat and soothe the inflamed lining of the stomach and intestines, like a protective bandage on the inside.
Okay. What about food? Do you starve them?
Actually, the thinking on that has changed a bit. Once you're feeling a bit better, maybe the vomiting has stopped. We usually introduce a bland, low-fat, easily digestible food in small, frequent meals. We generally don't recommend withholding food for extended periods anymore.
Why not?
Getting some nutrition in, even small amounts, can actually help the gut start to heal faster. It provides energy for the cells lining the intestine to repair themselves. In really severe cases, especially if their blood protein levels have dropped dangerously low from leaking into the gut, we might need to give them a plasma transfusion or special synthetic fluids called colloids to help pull fluid back into the blood vessels and maintain blood pressure.
Okay, so fluids, anti-nausea meds, pain relief, maybe gut protectants, and careful reintroduction of food. What about antibiotics? You mentioned the Clostridium link. Are they always used?
That's a really interesting point, and it's actually a topic of some debate currently in veterinary medicine.
Oh.
Well, while a bacterial imbalance, especially involving that Clostridium perfringens type A, is the leading theory, routine use of antibiotics isn't always necessary and might not always be helpful. It really depends on the individual case.
So what factors decide if antibiotics are used?
Vets will look at things like, does the dog have a fever? What's their white blood cell count doing? Is it really high or really low, suggesting severe infection? And how are they responding to the initial fluid therapy and supportive care? Because of growing concerns about antibiotic resistance, and also the fact that antibiotics can sometimes disrupt the good bacteria in the gut even further, causing dysbiosis, many vets are now more selective.
Makes sense. Don't want to cause more problems.
Exactly. However, if there is evidence of a more serious systemic infection, like signs of sepsis, or if the dog just isn't improving as expected with fluids and supportive care, then yes, antibiotics would definitely be considered. Usually one's effective against Clostridium species like ampicillin or maybe metronidazole.
Gotcha. So use judiciously.
Precisely. And after the acute phase, once things are settling down, we might recommend probiotics, those beneficial bacteria supplements to help restore a healthier gut microbiome after all that disruption.
Okay. And I think you mentioned isolation.
Yes, typically dogs hospitalized with severe bloody diarrhea like this are kept in an isolation ward. This is mainly as a precaution, especially before we've ruled out contagious things like Parvo and just good practice with infectious diarrhea, even though AHDS itself isn't considered directly contagious between dogs in the way Parvo is.
Okay, so fluids are the star, supportive care for symptoms, antibiotics maybe sometimes, probiotics later. What's the overall outlook? If a dog gets AHDS and gets this treatment, how do they usually do?
Thankfully, the prognosis for most dogs with AHDS is actually really quite good if they get that prompt and aggressive treatment we've been talking about.
That's reassuring.
It is. Many show dramatic improvement, sometimes within the first 24 hours of starting IV fluids. The average hospital stay is often around 3 days or so.
And afterwards, how long till they're back to normal?
You can usually expect their stool to gradually firm up and return to normal over about a week following discharge.
Okay. But are there risks? What if treatment is delayed or it's a really severe case?
Yes, it's crucial to remember that serious, life-threatening complications can occur if the condition isn't treated promptly or if it's an exceptionally severe case.
Like what?
These can include things like dangerously low blood protein levels, hypoproteinemia, a serious blood clotting disorder called DIC, disseminated intravascular coagulation, sepsis, which is a body-wide infection, hypovolemic shock from the severe fluid loss. And tragically, yes, it can lead to death.
So time is absolutely critical.
Absolutely critical. There's also a chance of the condition recurring later on. Estimates are maybe around 10 to 15% of dogs might have another episode at some point.
Oh, okay. Good to be aware of.
And the outlook might be a bit more guarded for very young puppies or dogs that have other significant underlying health problems already.
Right. That makes sense. So you've really emphasized how quickly this can happen and how serious it can be if not treated fast. For our listeners, the pet owners out there, what is the absolute key takeaway? When should they be absolutely sprinting to the vet, no hesitation?
The absolute bottom line is this. If you see bloody diarrhea in your dog, especially if it comes on suddenly, is very watery, and is accompanied by other signs like vomiting, lethargy, appearing weak, or any indication of abdominal pain.
Like whimpering when touched or standing funny.
Exactly, like whimpering or standing in that hunched over prayer position, you need to seek veterinary attention immediately, like yesterday.
Don't wait and see.
Absolutely, do not wait and see with those signs. As we've discussed, AHDS can escalate incredibly fast. A dog can go from seeming maybe just a little off to critically ill within a matter of hours.
Wow.
Early and aggressive treatment makes a world of difference. It dramatically improves their chances of a full and relatively quick recovery.
Okay. And what if the symptoms aren't exactly like you described? Maybe just a little blood or no vomiting?
That's a great point. Even if the symptoms don't perfectly match the classic AHDS picture, if you have any gut feeling that something is seriously wrong with your dog, if they seem unusually lethargic, if the diarrhea looks really abnormal to you, if they just aren't themselves, please always err on the side of caution. Call your veterinarian without delay.
Just your instincts.
Absolutely. You know your dog best. Any sudden, significant change in their health, especially involving signs like blood in the stool, warrants a professional evaluation. It is always better to be safe than deeply, heartbreakingly sorry later.
That is crystal clear and incredibly important advice. So just to quickly recap the main points. We've learned that bloody diarrhea in dogs, particularly when it appears suddenly and comes with other worrying signs like vomiting and lethargy, should be treated as a medical emergency because of potentially serious conditions like AHDS.
Exactly right. Prompt diagnosis and appropriate veterinary care, focusing heavily on getting those crucial intravenous fluids on board quickly, along with supportive treatments, is absolutely vital for achieving a positive outcome in these cases.
And the final, most crucial piece of wisdom for everyone listening today, the one thing to really take away.
If you have any concerns, no matter how small they might seem about your dog's health, always seek professional veterinary advice. Call your clinic. Get them checked out. It is always better to be safe than sorry when it comes to your beloved furry family member. They count on us to notice when things aren't right and to get them the help they need. That call could provide peace of mind, or in situations like AHDS, it could genuinely save their life.